I welcome all the doctors from inside the hospital and outside the doctors from various parts of the state who have joined for this webinar. Today we have two speakers, Dr. Lakshmi and Dr. Suganya, both IVF consultants. And Dr. Lakshmi is in this field for more than 2 decades. She has worked under the guidance of highly reputed doctors like Dr. Sadhar Desai from Mumbai, Dr. Kamaleshwari from Chennai, and even worked with Dr. Mridu Bhashni also. And she has coordinated several IUI and IVF related workshops, and she's an expert in all kinds of ART procedures. And even she has trained Korean doctors sponsored by WHO in conducting various ART and lab procedures. And today Dr. Lakshmi is there to talk about factors affecting fertility. And the other speaker is Dr. Suganya, who is also one of our dynamic IVF consultant, and she's alumni of our DNPOH department. She has worked with Dr. Mridu Bhashni for more than 5 to 6 years, and she has even coordinated many IVF related CMEs. She is also an expert in doing all kinds of ART procedures. She has finished her diploma recently in reproductive medicine from Germany. And she's there to give a talk about the myths and facts around IVF. I request Dr. Suganya to take over.
Thank you, sir. Thank you for the nice words. And good evening, all who are joined on this Saturday evening. Why we thought of taking this topic for this evening is this month we have an IVF day on 25th. And apart from medical people, there are many non-medical people who are talking about IVF. Rather than medical doctors who are really doing IVF, they are not talking much on this. So to start with, what I'm going to concentrate is to break the stereotype around IVF. What are the myths that is happening in IVF and what are the real facts? Because this will definitely help even our colleagues and also our patients. So whoever is seeing this can transfer a proper information, correct information to the patients, so that we get a better. The patients will have a better clarity and come to our centers. Yes, fertility treatments saved happiness of millions of families around the world. But unfortunately, there are some myths that stigmatize these treatments and make others wary of them. So they are getting scared to come into an IVF department. So it is not as common as they enter an obstetric and gynae department. Many patients, they have their own stigmas to come into an IVF department. So the idea is to make them more comfortable when they come to us. Yes, the first thing is about IVF treatment or ICSI treatment. The whole marketing world in ART, they say it is 100% guarantee, but it is not so. The whole world, it is about 40 to 60%. And in Ramakrishna, we have been very consistent in giving that result of between 40 to 60%. The 100% word is something, it's so fascinating that it attracts the crowd inside the IVF department, but that is not so. Being the medical persons, we should be telling them the correct success rate of this IVF treatment so that they will understand the reality and take this procedure for themselves so that they will get the maximum benefit of this treatment. Yes, of course, IVF, ICSI, it will increase the chances of conception, but the conception rate will depend on various factors like age, weight, the menstrual cycle, their hormones, yes, of course, lifestyle factors, both men and women, and of course, your reproductive system anomalies. So never we should say a patient, it is 100% guarantee. You walk into a clinic, you will go with the baby. That is not so. So we have to stop telling that. And if you're going to see any board on the road saying it is 100% guarantee, we have to laugh at it rather than rather than us telling ourselves why can't we give 100%? It is not 100. It's between 40 to 60%. So once we understand, we'll be making this point very clear to the patients so that they will have the maximum benefit of our treatment. Second, and all fertility clinics, because every day there is cropping of fertility clinics. Even in small villages, I think they will be starting fertility clinics. But no clinic can do any magic. No magic is done inside the clinic to make them pregnant. We have to have a complete cooperation from the patient. We have to provide personalized care to these patients. They have to provide treatment that suits each couple. We have to customize treatment. There is no universal law. There is no universal protocol that every clinic will standardly follow to make a couple pregnant. So every couple has individual attention. We have to spend a lot of counseling sessions. We have to make a lot of counseling sessions to them to make them understand what treatment they will fit into. So we shouldn't make the false belief that when we walk into this clinic, they will do some magic and give us a baby. So we are not up to it, and we are not supposed to do it too. So we should make them understand again that they will need a customized plan for their own factors depending on their age and their reproductive system. And expensive. Anyone who walks into a clinic, they are very scared to step into a fertility clinic thinking it is too very expensive. But why it is so expensive? Why it varies from each hospital to hospital? It starts from 50,000 to 3 lakhs to 5 lakhs to 10 lakhs. Why these hospitals keep so varied expenses for an IVF treatment? The one thing we have to understand is for doing an IVF procedure, whatever hormones we are using it is obtained either from a recombinant by a recombinant technology or either from the postmenopausal women. So this marketing of these hormones will be in Indian companies or from international companies. The hormonal injections are quite expensive. Of course, Indian rates we have about whichever a hormone we get from Indian rates. If it is 500, if you're going to use the same hormone from like an imported market, it goes up to 3,000. So there is a lot of variation in the expenses compartment from each fertility clinic, from one hospital to another hospital. So this we have to make them understand again, because when they walk in, they ask us that hospital said it will be doing it for 50,000 to 1 lakh. Why the other hospital says 2 lakhs? Why the other one is 5 lakhs? It depends upon the hormones what we use. If we want to cut down and slash the rate, we can do it even for 50,000 or 40,000, but that is not so, because the idea of doing any IVF treatment is we have to create grade 1 embryos which will give them a success, and always the first embryos what we create is the best, and we should be the first persons to give them a pregnancy. So we have to convince them for a better quality embryos rather than on the expenses. We shouldn't be compromising on that so that they will achieve a maximum pregnancy. And the next myth is fertility treatment, they won't come. Whoever is working, any woman who is working, they will not come for a fertility treatment, because considering that the treatment will prolong for them, they have to take an off from their work, and they won't be able to carry the work as soon like the other treatments. But that is not so, because of late we have been restricting the visits, number of visits of the fertility of these patients for about 6 to 8 times in the whole procedure. Earlier, it was up till 2 weeks. Every day they have to walk into the clinic. We have to prepare them for IVF, and the IVF cycle will take about 8 to 10 days of stimulation, and retrieval will be done, and then we'll be transferring the fresh embryos or the frozen embryos the next cycle. Of course, they will need the close monitoring, but we have restricted the number of visits of these patients to 4 to 6 visits, considering the time and their work pattern also. And whenever they walk into us, we should respect their time, because they'll be repeated visitors to us. So we respect their time and we treat them early, we scan them early, and we do the treatment also early. So fertility treatment will not take that too long, and everyday visits is no longer recommended. Yes, during this IVF treatment, whether all the pregnancies will lead to multiple pregnancies like twins or triplets is another question. It is not so again. It depends on the number of embryos we transfer. The whole world is transferring only the single embryo. But only in India, we are little liberal in transferring 2 or 3 embryos. And when a patient comes with a pregnancy with 4 or 5, we shouldn't be happy. We shouldn't be happy about it, because the idea is not to transfer more number of embryos, not to get into a lot of multiple pregnancy. The goal is to achieve a single term live birth for any infertile patients. So the percentage of success is not with the proving a pregnancy card to be positive. The pregnancy card can be positive, but the baby should be live at the end of your pregnancy. That is the idea of any fertility treatment. They have to go with a baby in hand who's healthy. So the idea of getting a single baby in the hand is the ultimate aim. So now transferring more number of embryos and getting multiple pregnancy is not the idea. So we usually transfer single or 2 embryos to make the efficient pregnancy. And the other common question is whether IVF babies will be abnormal babies. IVF or HC babies or frozen babies, these babies will be abnormal, like unlike a natural conception. Nowhere these babies are different from the normal babies. There is no increased risk to the babies conceived through IVF. In a general population, there is of course a 3 to 4% chance of birth defect. Same level of birth defect happens even in IVF or ICSI babies. No change in the IQ level, no change in the fetal monitoring, no change in the antenatal period monitoring, and of course, term delivery will be the goal. So there is nothing called anything abnormal IVF babies or abnormal ICSI babies. All babies are babies, even if they are conceived. The method of conception is only different, but otherwise everything is the same. We have to take this off from the patient's mind. And regarding hospitalization, when they come in, they keep in the hospital for months together. They are admitted, and they'll be completely like 8 to 9 months hospitalized. But we have to make it a point. We have to be very proud to say that we haven't hospitalized any patient till now for our IVF patients. All were working even after transfer. They were traveling. They were doing all their work. So IVF pregnancy is same as normal pregnancy. Just they need a little bit of progesterone until 8 weeks because we are completely retrieving the oocytes. The ovary is not that very functional up till 8 to 10 weeks. So they will need a little bit of progesterone. Apart from that, nothing. And no bed rest is mandatory, no hospitalization is required, no special injections as it always mentioned. And they can work, they can travel, they can carry on their routine activities. Only minimal drugs will be given during the pregnancy. And of course, they will deserve a normal vaginal delivery. Just because they have gone through an IVF pregnancy doesn't mean that they will need always cesarean sections. And we are again proud to say that on this platform that we always do a normal vaginal delivery for IVF patients unless otherwise it is mandatory. And the other common question when they get married, when they are young, when they walk into fertility clinic, the whoever at home, they tell the couple, you're too young to start in fertility treatment or you're too young to start an IVF treatment. It is not so. If the couple deserves an IVF treatment or ICSI, they have to go through the treatment because they will have some disease process which will be affecting their reproductive ovarian reserve, and coming late will be almost they'll be losing their reproductive potential. Of course, the peak reproductive years is between 18 to 28 years, and minimal decline starts at 28 years to 34 years. And of late, we see a lot of late marriages, but since even after like 28, they don't come to a clinic, they wait up till 34. But the decline starts then. There'll be 30% chances only between 34 to 37 years of the female age, and chances of conception drastically falls after 37. So it's better. There is nothing called too young to come for a treatment. Anytime they want the baby, they have to start it early to have a happy pregnancy. And of late in this digital world, the common thing what we hear is not interested in pregnancy. So they'll get married, but they're not interested in pregnancy. They wanted to postpone their pregnancies. So many couple they are walking in. There is an option of freezing their eggs so that they can store their oocytes. Even if unmarried girls also they come and they can do it. And after that they can plan their family when they need it. These eggs are retrieved and they can start their fertility period. But this option of freezing the oocytes or the sperms was started mainly for oncofertility. When they have any problem like cancers, that is what it was started for freezing the oocytes and the sperms and the testicular sperms. But of late in this modern digital world, we see that since I'm not interested in pregnancy right now, I need some of my time. So we have started freezing the oocytes even for the young girls. We can recommend them also if they need. We can't deny them. And thank you for all this patient listening. Hope I had little bit of clarity on all the myths which is happening around the world, so that we'll be able to clarify to the patients what is essentially needed to them. Thank you.
Thank you, Dr. Sugunya.
Thank you, sir.
Yeah. And I request Dr. Lakshmi to take over.
Good evening. After a wonderful talk by Dr. Sukanya she has cleared all the myths that is surrounding the IVF. We will look into what are the factors that we should look in the infertility and what which have implication on their outcome. Now, infertility is designed as the couple has not for more than 12 months after a regular unprotected sex. It is considered as a disease nowadays, and it is a global problem. Coming to India, the fertility is also dropping in India, and it is said that from 1950 to 2021, the fertility rates are 5.9 it has fallen to 2. That means in 1950s, the people were having 5 to 6 children. Now it has come down to 2 children. And that's how the fertility is dropping. That could be the only reason, or there are some states in India, like Sikkim, it has got only 1. The main reasons what they are thinking is it could be the women empowerment. The women empowerment has caused delaying in marriage, delaying in their childbearing, or the husband is staying in one place, the wife is staying in the other place, and by the time they decide to have their family, it's too late. And that is one of the reasons. And third is the economic progress and a smaller nuclear families. Now, we are going to talk about the 4 important factors which can cause the infertility and what implications it can have. That is, one is the age, obesity, stress, and number of years of marriage. That is what I'm going to speak on. So, let's look at some general facts. Women are very different to men with regard to reproductive aging. The woman's entire lifetime supply of eggs is present at birth. She'll have something like 2 million, and by the time she reaches 45, it comes to about 1,000. Decreasing is inevitable with the increasing age and complete infertility by the age of 40 to 50 years. Just we had a discussion about how after 34, the fertility rates is dropping. So you can see at birth, the women are born with 2 million sperm, 2 million eggs. At puberty, it comes to 400,000, and then it drops to 1,000 at menopause. And at 37 years, it is just 27,000 oocytes are left. So as the woman ages, her ovarian reserves start falling. The hormones which control the egg development, like FSH, that starts rising, and the ovary reserves are depleted to less than 1,000 by the age of 51. From 38, the reserve will drop very dramatically, and there is a significant decrease in fertility. So our aim is to counsel the patient to start their families at least as soon as they get married. So because we don't know when their fertility would fall. Now, female age is considered as a strongest predictor of success. Whichever treatment you try normally, or you go with IUI, or when they come for IVF, any sort of treatment, the age is the stronger predictor to tell about the success. With increasing age, there is a decrease in oocyte quality. Even if you think we can do IVF and overcome this negative impact, it's not possible because age is the most important factor. As we have just discussed, the 25 to 20, 18 to 28 years or 30 years is the best time to fall pregnant. After 35, it has started falling. And of late, we are seeing as young as 25-year-old girls coming with the low ovarian reserves. Now, according to the Center for Disease Control, how many people start experiencing infertility? 30 years, 7% will experience infertility. By the time they're 35 years, 11% of the women, 40 years, 33, and 45, 87. Thus, women less than 30 years, there is no conception. After 1 year of trying, you should evaluate the couple. Is the 30 years the cutoff? No. There are certain other factors which will decrease. We'll discuss. Now they have done a lot of studies saying what is the pregnancy rate in these age group. Less than 35 years, they found that the pregnancy rate is only about 8.75. When they come to 40 years, it is about just 7%. Some studies are putting it as 6%, and after 41, it is 4.7. There was a beautiful survey was done by the Coimbatore health department, where the number of birth registrations they were looking at. They found that the women more than 35, even with the spontaneous pregnancies, the birth registrations were very less. The maximum registrations happened between 25 to 34. Now, next is the duration of infertility. There's a lot of debate about it. And they say with the increasing age, with the increasing duration of infertility, even IUI, simple treatment will become less effective. Then some studies say 7 years as the cutoff point, but still there's a lot of debate when to start, give them, offer them an IVF. Now, sorry, we'll go back to the previous. Now, I was talking about the age of declining fertility, but there are 10% of women who would become menopausal by the age of 45 and will reach the end of the fertility potential. See, from 35 to 45 is the time when the number decreases and the aneuploidy rates increase. So the fertility potential will start dropping. That is 13 years prior to their menopausal age, the ovarian function starts decreasing. So who are going to become menopausal by 45, their ovarian function will start declining from 32 years of age. So we need to identify this silent group and who is at risk. The prevalence of premature ovarian failures or premature menopause is about 10 to 25%. Now, how do we test them? There are three tests that we do, which will tell you that how the woman's ovarian functions are going on. One is the age, as we have discussed now. Second is the hormone, the latest one, which is the anti-Mullerian hormone. The other hormones, they can vary according to their menstrual cycle, but this anti-Mullerian hormone can be done any stage of periods. Like they don't have to do on the second day of the periods because most of the tests are carried out. This can be done at any cycle, any day of the cycle. This is a very stable hormone which will tell you the number of eggs that are left over. And third is by doing clinically, by looking at the ultrasound, looking at the number of antral follicles that are there. So you can look at this, the number of follicles. Here, these are the small follicles, are all quite a good number. This becomes a normal ovary or a PCO ovary. Whereas this same ovary is very small, it has got a very few number. So when a woman complains there is a shortening of cycles, she was having say 30-day cycle and she says, doctor, now it is coming 26 days, 6 months ago, now it has just become 21 to 25. We have to be alarmed. The shortening of cycle indicates deteriorating ovarian reserve. Say, for example, there is a woman aged 37 years and her AMH is 0.7. With aging, this number AMH will fall, and this is showing as age appropriate. But same person, another girl, 22 years, her AMH is 0.7. It indicates that she has got premature diminished ovarian reserve. So AMH becomes a very important test to identify the woman at risk of losing their fertility potential, and we should be able to identify them and guide them. So any modality of treatment, low pregnancy rate and live birth rate are going to be lesser for them. Now, ovarian reserve, is it, how do we, there are some group of women who are less than 30 years of age, but if they give a history that they have been exposed to certain like confirmed gonadotoxins like tobacco, smoke, chemotherapy, or radiation therapy, or there is a strong family history of an early menopause or premature ovarian failure, or they have gone through a surgery wherein they have had ovarian cystectomy done or a single ovary has been removed, even though she is less than 30 years of age, she should be taken into an account and an early evaluation has to be started in them. Does this apply only for the women? No, even men who are more than 41 years, they will have significant number of abnormal sperms. So and it doesn't apply only to the women, even to the men. With aging, their fertility potential also falls, and especially after the age of 41. Now, when we look at the sperm, sometimes you may come across any semen reports and they might say that is it okay to go in for a treatment? Now, the number of sperms that is required, minimal for treatment, simple treatment like an IUI or for a normal conception, should be at least the total motile sperm should be around 5 to 10 millions. The motility should be at least 30%, and the morphology should be less 4%. Only then we can advise them either to try normally or to go in for an IUI treatment. Now, second important thing is obesity, and this is becoming a very phenomenally high in our country. The prevalence rate of obesity in India is coming to about 11.9 to 31%, and this is more in the urban class. Now, what is obesity? It is an abnormal or excessive fat accumulation that impairs health, not only just the health, the entire body from head to toe. This is due to the increased calorie intake and lack of physical exercise, and every system of body is affected. Women are more obese than men because men have got more muscle mass and less fat, and they have high metabolic rate and they burn more calories. Now, how does this obesity cause in a woman? In women, it can lead to menstrual irregularities, and if she becomes pregnant, they can have pregnancy complications like hypertension and diabetes. As we just discussed, the women are more obese than this. And this is a global problem, and especially among the reproductive age group. And now we see them more and more in the adolescent groups also. Now, this is the PCOS. Now, increased obesity can cause what is a common condition in infertility that we see is PCOS, that is polycystic ovarian disease, where because of the obesity, this PCOS gets manifested. And in Indian data, it is as high from 8% till 22%. This is so commonly seen. This is in the general population in all over the country, that they have taken from various states like Mumbai, Andhra, then Sevagram, that is, and Vellore. Now, PCOS is defined as the woman, when you come across anybody with the clinical signs of androgen excess like acne or hirsutism, or they have got any biochemical signs like increased testosterone, DHEA, or androsterone, and in addition, they have got irregular cycles, or clinically we see more than 10 follicles in scan, they can be grouped as PCOS. Now, how do we counsel them? That is the diet and exercise. The diet should contain low in saturated fats, increase in dietary fiber, which has got low glycemic index, and low glycemic index foods include bran, cereals, mixed grain breads, lentils, and soya. And some form of exercise, and that exercise should be at least minimum of moderate exercise to vigorous exercise who has got intolerant glucose and impaired glucose tolerance, and this should be distributed over 3 days, and at least they should exercise for minimum of 3 days in a week, and for long-term weight reduction 1 hour per day exercise is recommended. The next common problem that we come across the family member is in the reproductive age group is the stress. Does stress cause infertility? This is a debatable. Stress can cause infertility or infertility can cause stress. Now, infertile couples are increasingly seeking assistance through IVF and ICSI, as we have just now, Dr. Sukanya has told about that how the media is claiming 100% success rate. So their aspirations becomes more, and they claim all the things. And once they have conducted so many surveys, and they found that in reality the success rate can be much lower, less than 50%. So once they have a negative result, it leads to their depression, anxiety, and crisis. It leads to a crisis, and they are unable to recoup from this condition. So once the patient comes, they have to be counseled very cleanly about the success rate, saying that it is less than 50%, and it could be they have to just go ahead with the treatment. And so many times they drop out from the first cycle itself, and you see them after many years, they don't come out of that crisis. That is the grief that they had gone through. They say it was too much. And this modern day living, where the husband is living in one place, or they've got long working hours, the couple, and they have to wait at the doctor's office, all this leads to their stress, and we got to be more concerned about them and take care that they don't feel left out. And they should be counseled not only just from the clinician, it is starting from the reception that these people should be taken more care. So, to coming to conclusion, there are four factors which shall have a lot of implications on the infertility. One is the age. The couple has got more number of years of marriage. They are obese and they are stressful. These four factors, if you look into them and counsel them adequately, I think we can help them out in this from their sad status. Thank you.
Thank you, madam.
Thank you, sir.
Any questions from the audience?
Since they are
Yeah, no, no
we'll,
more. Yeah.
yeah, thank you very
Yeah.
much for the opportunity given on behalf of Dr. Sukanya and the entire department. I thank the management for giving us an opportunity to share few words on fertility treatment. Thank you so much.
Yeah, subsequently, I thank madam. I thank Dr. Lakshmi and Dr. Suganya for giving such a wonderful talk. Hope
Thank
it
you.
should be useful for every clinicians who have attended. And I
Thank
thank all the doctors who have joined this webinar on behalf of the management of Ramakrishna Hospital.
Thank you.
And I'd like to thank the PR department, marketing and IT department for organizing this session. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.